Hi, good evening friends. Pradeep Pendyala, Professor of Anesthesiology, your buddy, and today I am going to talk about oxygen therapy. That would be very brief and interesting, and today I am also going to tell you about one famous physicist from Switzerland. His name was Bernoulli, and Italian physicist whose name was Venturi. That would be very interesting. But before that, let's talk about oxygen therapy. So, some supplemental oxygen, rather the use of oxygen as a medical treatment is usually for low blood oxygen or carbon monoxide toxicity, cluster headaches, and to maintain enough oxygen while inhaled anesthetics are being during anesthesia. Fine? Long-term oxygen is often useful in people with chronically low oxygen, such as in COPD, chronic obstructive pulmonary diseases patient, or cystic fibrosis patient. Oxygen can be given in a variety of ways, including nasal cannula, face mask, or inside a hyperbaric chamber. I'll tell you very interesting things about oxygen. By the way, are you aware that oxygen is a strong vasoconstrictor? It's not a vasodilator, it's a vasoconstrictor. Of its own is not combustible, but it hugely facilitates combustion. So be careful if you are smoking, don't sit next to the oxygen and start smoking, there will be huge problem. Okay. Well, I was talking about oxygen and its vasoconstrictive effects on circulatory system. Now think about a condition called stroke. Would you be giving oxygen? Obviously, you would say you should not, because it will further deteriorate the condition because of its reducing peripheral vascular circulation because of its vasoconstriction. But incidentally, you have to think about there is one law known as Henry's law. This allows a compensating change to occur, and the dissolved oxygen plasma supports embarrassed oxygen-starved neurons, which reduces inflammation and post-stroke cerebral edema. That's how it can be used. By the way, you must have heard paraquat poisoning. I'm sure during your MBBS days, this paraquat poisoning must have been a topic of discussion. Paraquat is used against weeds and as a herbicidal, and during farming and all, which can cause severe poisoning. And if a patient comes to you with paraquat poisoning, would you be giving him oxygen or not? No. It should never be given to a person who has paraquat poisoning unless they have severe respiratory distress or respiratory arrest. Okay. By the way, there is also oxygen therapy is not recommended for people who have pulmonary fibrosis, especially who has damaged lungs due to bleomycin treatment, which could cause pulmonary fibrosis. You should never give oxygen. And which all places oxygen can be used? Before that, one question is usually asked during your viva, just to test your common sense. What is the difference between hypoxia and hypoxemia? Don't be bold with this question. It's a very, very simple question. Hypoxia is nothing but lack of oxygen at tissue level, and hypoxemia is low oxygen tension in the arteries. When the PaO2 is less than 60 millimeter mercury, we call it hypoxemia. And I had mentioned where the oxygen therapy is needed. Cardiac respiratory arrest, hypoxemia, where the PaO2 is less than 60 millimeter mercury, or saturation pulse oximeter values are less than 90%, and there is severe hypotension, and the BP is less than 100 or 90, less low cardiac output cases and metabolic acidosis and respiratory distress. Respiratory rate is more than 24 or 35. More than that, you have to give oxygen. And what are the possible causes of hypoxia? Very simple. Low inspired oxygen partial pressure. In high altitude, this problem would be there of hypoxia. Alveolar hyperventilation during sleep apnea or narcotic overdose, ventilation perfusion, mismatch known as VQ mismatch when atelectasis or pneumonia or asthma occurs. Ventilation, right to left shunts. Yes, during that also there may be hypoxia. When the oxygen hemoglobin transpose system is not working or there is a failure, this would happen, hypoxia. Inadequate tissue perfusion, cardiac failure, myocardial infarction, hypovolemic shock, it can lead to hypoxia, and abnormal oxygen dissociation curve, that is ODC, is abnormal where during carboxyhemoglobin or hemoglobinopathies. You need have hypoxia and there is a requirement of giving oxygen. Increased oxygen requirement, hypermetabolic states or histotoxic poisoning of intercellular enzyme like cyanide poisoning. Well, how would you classify oxygen therapy devices? Very simple. Performance of the device, fixed Venturi mask, flows delivered by the device, low flow, nasal prongs, face mask, patient dependent face mask, nasal prong, CPAP device or patient independent, that means ventilators. And degree of dependency, low dependency is face mask, nasal prongs, medium dependency where we use CPAP, continuous positive airway pressure mask and other equipment, high dependency, obviously, ventilation, invasive positive pressure ventilation. It could be also non-invasive. Well, that's that. I'm sure it was interesting, but before that, I'll give you some more thing. As I had promised that I'll be talking about two very, very interesting people. A physicist from Italy, that is Venturi, and his effect, you should never forget, Venturi effect. And the other physicist from Switzerland, Swiss physicist, Mr. Bernoulli. Bernoulli had given a principle known as Bernoulli principle. So far, so good. But Venturi, the physicist from Italy, was very smart and he used that principle of Bernoulli principle for Venturi effect. And he's changed the entire world. There are thousands of devices today, as of now, where these are based on Bernoulli principle, but they are being used as with the Venturi effect. Now, what is this? The relationship between velocity and pressure exerted by a moving liquid is described by the Bernoulli principle. As the velocity of fluid increases, the pressure exerted by the fluid decreases. That's how the pressure decreases, and then will be entrainment of air or something else which is connected to it. That's how the principle works. Now, would you know this principle, Bernoulli principle and the Venturi effect is being used in thousands of gadgets and thousands of things. It would take one day to tell the number of things where Venturi effects are being used. I'll tell you few. Sanders jet injector, Venturi mask. I'm sure you have heard various Venturi masks which are used for delivering oxygen, and inspirator that mix air and flammable gases and grills, gas stove, and Bunsen burners. I'm sure you have used Bunsen burners very often in your chemistry labs or biochemistry. Steam siphons use the kinetic energy from the steam pressure to create partial vacuum. Water aspirators that produce a partial vacuum using kinetic energy from again faucet water pressure using Venturi effect. Atomizers, the simple perfume which you use, the spray paint which you use so very often is nothing but Venturi effect. Foam fire fighting nozzles extinguisher, fire extinguisher are nothing but they use Venturi effect. Everywhere, name a place, in cars, carburetors use Venturi effect to suck gasoline. Gasoline is nothing but petrol into the engine's intake airstream. Industrial vacuum cleaners again operate the same. Venturi scrubbers are there, injectors are there. Steam injectors where principle is again used Venturi principle, Venturi effect. Sand blasters, a scuba diving regulator, modern vaporizers definitely use this Venturi effect, and ventilators also use it. Incidentally, recoilless rifles, can you believe? In recoilless rifles also Venturi effect is being used to decrease the recoil of firing. Automated pool cleaners, all these things are nothing but Bernoulli principle and Venturi effect. Strange but true. I'm sure you have loved it, and there is so much more to know about oxygen therapy. I won't make it a long discussion and a boring affair. Thanks for patient listening. Have a wonderful day. Until next time, goodbye. Take care. This is Colonel Pradeep, Professor of Anesthesiology at Asram Medical College, Eluru City of Andhra Pradesh, India. Bye-bye.